Hemorrhoids are a common health concern. They affect millions of people. Hemorrhoids are swollen blood vessels. They occur in the rectum and anus. External hemorrhoids are located under the skin around the anus. Imagine these blood vessels like tiny balloons. When they experience pressure, they can swell and become painful. This can lead to discomfort and bleeding, particularly during bowel movements. While this condition can be embarrassing to discuss, it's important to remember that it is very treatable. Knowing the difference between internal and external hemorrhoids is important. Internal hemorrhoids develop within the rectum. These are usually painless. You might not even know you have them until you see blood in the toilet. External hemorrhoids develop outside the anus. These are the ones that cause the itching, pain, and discomfort. Understanding the nature of external hemorrhoids is the first step towards effectively managing and treating them. If you suspect you may have hemorrhoids, don't hesitate to consult with a healthcare professional. They can provide an accurate diagnosis and discuss the best course of treatment for your individual needs. Several factors can contribute to the development of external hemorrhoids. One of the most common is straining during bowel movements. This is often associated with constipation. When you strain, you increase the pressure on the veins in your rectum and anus. This can cause them to bulge and become hemorrhoids. Pregnancy is another common risk factor, particularly in the later stages. As the uterus grows, it puts pressure on the veins in the pelvic area, increasing the likelihood of hemorrhoids developing. Other factors that can contribute to hemorrhoids include obesity, a low-fiber diet, and prolonged sitting. External hemorrhoids typically present with noticeable symptoms. One of the most common is anal itching. This can be intense and persistent, making it difficult to ignore. You might also experience pain or discomfort around your anus, especially when sitting or during bowel movements. Another telltale sign is bleeding during bowel movements. The blood is usually bright red and appears on the toilet paper or in the toilet bowl. You may also notice swelling or a lump around your anus. This can be tender to the touch. If you experience any of these symptoms, it's essential to consult with a doctor. While these symptoms could indicate hemorrhoids, they could also be signs of other conditions. Only a medical professional can provide an accurate diagnosis and recommend the appropriate treatment. Diagnosing external hemorrhoids is typically a straightforward process. Your doctor will start by asking about your symptoms and medical history. They'll want to know how long you've been experiencing symptoms, their severity, and any other health issues you might have. Next, they will perform a physical examination. This will involve visually inspecting the area around your anus for any signs of hemorrhoids, such as swelling, lumps, or irritation. They may also perform a digital rectal exam. This involves your doctor gently inserting a lubricated gloved finger into your rectum to feel for any abnormalities. In some cases, your doctor may recommend additional tests, such as an anoscopy. This procedure uses a short tubular instrument called an anoscope to examine the anal canal. This helps to rule out other conditions and determine the extent of the hemorrhoids. The good news is that most cases of external hemorrhoids can be effectively managed with non-surgical treatments. Your doctor will recommend a treatment plan based on the severity of your symptoms. One of the first lines of treatment often involves lifestyle modifications. This might include increasing your fiber intake, drinking plenty of water, and getting regular exercise. These changes can help soften your stools and make them easier to pass, reducing straining during bowel movements. Your doctor may also recommend over-the-counter medications. These can include topical creams or ointments that contain ingredients to soothe itching, reduce inflammation, and shrink hemorrhoids. For more severe cases, your doctor might recommend minimally invasive procedures. These are performed in an office setting and typically involve minimal discomfort. Some common procedures include rubber band ligation, which cuts off blood flow to the hemorrhoid, causing it to shrink and fall off. Surgical options are usually reserved for cases that haven't responded to other treatments or for very large or thrombosed hemorrhoids. These procedures are performed in a hospital setting and require a longer recovery period. It's essential to remember that you don't have to suffer in silence. If you're experiencing the symptoms of hemorrhoids, don't hesitate to seek medical advice. Early diagnosis and treatment can help prevent complications and improve your quality of life. While some factors that contribute to hemorrhoids are beyond our control, adopting a healthy lifestyle can significantly reduce your risk. This includes eating a balanced diet rich in fiber, staying hydrated, exercising regularly, and avoiding prolonged sitting. By taking proactive steps to maintain your digestive health, you can minimize the likelihood of experiencing the discomfort and inconvenience of hemorrhoids. For more info, visit mdsearchlight.com. Remember, your health is your most valuable asset, and taking care of it should always be a top priority. MD Searchlight. Be your own advocate.